I'd be willing to guess this is probably the first time in our state's history the lieutenant governor has had to participate in a press conference from his 9-year-old's bedroom. But that's just the way it goes sometimes. I can tell you it's been 5 days since I tested positive for COVID, and that's why I'm here at home, because we need to isolate when this happens. I do, however, want to say thank you so much for your well wishes. I'm feeling okay, continuing my work from here for the Gov and the state. And this virus affects people in different ways, so I've been lucky to have relatively minor symptoms. Regarding today, I'm looking forward very keenly to working with Major General Hara, Dr. Libby Char, our new Director of Health, Dr. Ginny Pressler. I enjoy working with these people because they're strong people, they're thoughtful, and I also plan to be the bridge between public health policy and operationalizing and implementing our strategic response. So I'm honored to have this role. Our team has worked, as you know, for the last several months on a pre-travel testing program, and we've sought the input of many people across the state, many entities, including healthcare, transportation, government, business, and people all across the community. The pre-travel testing program is going to be, as the governor mentioned, another tool and a layer for safety for our residents and for visitors. Additionally, it definitely provides an economic opportunity for our state when so many people are suffering. I worry about the long-term impacts of economic distress and that impact that it's had on our people when they can't afford their homes as easily or groceries or healthcare. So this is an important announcement the governor has made today. In brief, let me just run it down for you how it's going to work, how it will look. Arriving passengers will be exempt from the 14-day quarantine, if they test negative after taking a COVID-19 test no more than 72 hours in advance of travel. At this time, the test will be a nucleic acid amplification test. The code for that is NAAT, and conducted in a certified CLIA lab. That's the same kind of test that we've been getting when we have that swab in our nose. If test results are not available at the time of arrival in Hawaii, travelers will have to remain in quarantine until they get their test result. That's very important. The result comes in later, negative, and it's verified, then they'll be released from their quarantine. All arriving passengers, all of them, including children of all ages, will be subject to the pre-test requirement. Travelers will be responsible for the cost of their test on the mainland, and no commercial testing is going to be provided at our airports as of now. So we're trying to be very deliberate with this approach to get ourselves open, but safely and securely for our state. I will point this out. A lot of people are probably thinking this. The technology of testing is rapidly evolving. So as cheaper, quicker tests become available, and we have acceptable tests that are specific and sensitive, we'll work with DOH, DOT, airports, healthcare people everywhere to use those tests also. So this will continuously improve, and it'll get easier and easier. Additionally, as the world gets closer to a COVID-19 vaccine, and this is probably the most important thing I'll get to talk about today, we're developing a strategy for administering the vaccination to all of our community because it's going to be a monumental undertaking. Before people ask, I want to be very clear, the vaccine will not be mandatory. We're working on this plan right now, and Dr. Char and I particularly will be focused on this. She's our Director of Health and terrific. So we're prepared to get the vaccine to people who want it when it becomes available. There are projections about when, I don't want to guess, but we will be on top of this to make sure it's safe for our people. Of all these initiatives, including mass testing, contact tracing, a pre-travel testing program, and a vaccination plan, all of this is going to require the cooperation of everybody. And we've seen that through the entire pandemic. We do need to work together. So as we go forward, working with many organizations in the community, public and private, having someone in addition to the team of General Hara and Dr. Char, we're really lucky to have Dr. Ginny Pressler. She was previous Director of Health, and she has an incredible network and amount of experience to bring people together and help execute a big plan for us. So I think the governor's made a great choice. I'm so honored to be a part of the plan. So again, thank you, Governor, for welcoming me to this new iteration of our leadership team. And again, thank you guys for your well wishes.